Okay, now you can start, sir. Afterwards, Surendra sir will take.
Good evening, everybody. I'm welcoming all to our today evening's program. Today, all our faculty members will be discussing various topics. Surendra sir will go ahead with the session first, and then I will take, and then sir will go ahead. So, welcome Surendra sir. Please go ahead. Surendra sir,
Sir, Surendra garu.
you are muted. You are muted, I think. Can't hear. Muted.
Sir, Surendra sir.
You are muted, sir. You are unmute.
நான் ஒரு பிளாக் ஆச்சுன்னு நினைக்கிறேன். சுரேந்திர గారు.
Can't hear you, sir. We can't hear you, sir. I think you have to cut and come back again.
Sir, you can start. Sir, you can start. Afterwards, you will take.
Okay. So while Surendra sir comes back, I will.
You can give to him. Yes.
Today I will be discussing a new topic which is not normally in our series, but this is about a little history about homeopathy and the birth of modern psychosomatic treatment. This I had read an article on a magazine, and I thought it is better we will discuss that here. This article is written by Dr. Trevor Cook. He is PhD, MSc, PhD honors, and he's a homeopath, and he has written a lot about homeopathy's history. So now we will see what it is. This is basically earlier, before the advent of this modern homeopathic treatment or any other treatment, the Western treatment, the American treatment was very barbaric. And it was unbearable for anybody to even think about it now. It was bloodletting, then heat treatment, and then there are a lot of torture which the patient used to go through. And when you see it is it's a mental patient, then the treatment was even worse. So in this, the discussion is about the King George III, the King George III of England. He was diagnosed to be little he was a psychiatric patient at those times, but those days the psychiatry was not so developed, and he was subject to a lot of torture by those the best doctors of those days. And the abstract says King George III of England, so his time was 1738 to 1830, was the eldest son of Prince of Wales, who inherited the throne on the death of his grandfather in 1760, 5 years after Samuel Hahnemann was born. So Hahnemann was born in the time, but he is not yet found the homeopathic methods. He was just a normal person at the time. In spite of his efforts to raise the moral tone of the government, he became less popular. So this King George III of England was trying to do his best for improving his government by doing a good job, but he was less popular through his attacks of what was considered as his time as lunacy. Lunacy means insane, that is mental illness. So he was mentally not well, it seems, and that is why he was not popular. And the loss of American colonies, for which he was widely responsible for. So because of his wrong decisions, the English lost their colonies in America in the time of King George III because of his insane type of decisions. So Uh, this is King George III. You can see doctors are around him. He's being, strapped to a seat. His legs are tied up and everything together, and doctors are attending to him. You can see blood patches on all over the body. He was blood was let from him, and he was undergoing their type of treatment, which is torture according to us now. So it could be argued, however, that his allopathic physicians displayed real lunacy. That is, the doctors were lunatic, not the patient. That is the key. We know now that King's malady was porphyria. That is a type of mental disorder, and a toxic psychosomatic disorder traceable to metabolic disturbances rather than to due to some schizophrenic or maniac depression or lunacy. It's a metabolic disorder what he was going through, and they diagnosed it as a lunatic disease and had been treating him as a lunatic patient. Thus, afflicted, he became a victim of allopathic physicians. So he was treated as a patient of lunacy and was given such torture type of treatments. The king suffered repeated bouts of delirium, which became more or less permanent by 1810, the year of publication of Hahnemann's Organon of Medicine. So 1810, Hahnemann has already published this publication, the Organon of Medicine. During this time, the king was subjected to repeated assaults by his team of 5 warring allopathic doctors in the name of so-called therapy, and which was it was obvious, it was barbaric, palpably barbaric and ineffective. So the treatment was barbaric and ineffective. It was unfortunate that the king could have benefited by the homeopathic treatment had the Organon been published 10 years earlier. So if the Organon was published 10 years earlier, then he would not have been exposed to this sort of barbaric treatment, and he would have been treated in a little more better manner. So this therapy typified the inhumanity, cruelty, and quackery of the system of medicines as practiced by the contemporaries of Samuel Hahnemann. So Hahnemann also was a medical doctor, and he also was he got rejected because of this sort of treatment given to his patients only. So he was an MD in allopathic system, and the allopathic system was following these sort of barbaric methods, and he got fed up with that, and that is why he wanted to find a little more, human, compassionate, effective methods. So this appalled him and inspired him to establish homeopathy, which is gentle, human, compassionate, and effective alternative based on clearly comprehensible principles. So this is why he had to split off from the barbaric system followed by the allopathic system, allopathic doctors at the time. So medical practice of the day was then based on purgative methods, that is giving medicines to loosen your stools, then drawing the disease from the body. That is, yes, they think the body is full of disease and the blood is the cause of that. They remove the blood, consisting largely of vein sections by a knife and or blood leeches. So they will cut the vein and remove the blood out, and then they will the patient will be very weak. He can die also, and sometimes they will even use leeches to remove blood from the body, and then they will give massive doses of laxatives, harsh emetics, that is a substance which is causing vomiting. So they will give vomiting, the medicines for vomiting, they will give medicines for loose motions, creating loose motions, and they will also remove blood, and then they will put leech on your body, because totally you can imagine how torturous it is. And then they will give purging and such as enemas or ever increasing dose of high toxic nostrums. So they will keep on increasing the dose of the toxic nostrums. Nostrums are medicines prepared by an unqualified person. So they will make some decoctions, some concoctions, and with many herbs and leaves and chemicals and all, and make the person drink it, and he will have loose motions and vomiting. So this is the type of treatment which had been followed by the allopathics at the time. It was these practices which led Hahnemann to declare that, in his view, more sick people died of their treatment rather than their diseases. So treatment killed the patients, not the diseases those days, and Hahnemann was against those treatment. So the terrified King George was bled repeatedly, blistered. That is, he was cut, punctured, blistered, which get infected. Medicated with massive dose of foul, toxic nostrums, straight-jacketed, strapped. We have seen the picture, strapped and on a restraining chair, or strapped to a wooden plank, which was repeatedly rotated between horizontal and vertical position, and bullied by quarreling doctors, physicians who could not agree on his treatment. So this is the torture what the King George went. He was tied up to the chair, or sometimes he will be tied up to a wooden plank, and he will be rotated in a horizontal and vertical manner, so that he will lose his composure, and then like he will become that is when he is angry and as in rebelling against the treatment. Maybe they will give these sort of torturing situations for the patient, and this is the type of the treatment which they give to anybody, and this is more than a punishment. Clinical studies were confined to close inspection of the king's bowel movements, followed by fierce argument among them. So the only treatment what they do is they will check the bowel movements, whether he is passing stools properly, and if it is a loose motion or the normal stools, and then they will argue on that. This is the only treatment which they used to do. Otherwise, it will be just argument and torture. So Hampert, 1945, reconstructed typical methods employed at the turn of 18th century. He was a bloodless old man with wrinkled yellow skin. The king became that way. He is a bloodless old man with a wrinkled yellow skin. There is yellow because there is no blood. The doctors took a knife and opened the vein above this sufferer's elbow. He caught the spurt of blood. When they cut the vein, the blood comes out in spurts, and that is collected in in an earthenware vessel. He had only done that. He had only done what other doctors have taught him to do. The patients must have his vein opened to drain the disease from the body. A mighty shudder convulsed the sick patient, a sick man's body, and they stood in an ineffable silence. After when the patient falls unconscious or like falls down, then they will have a silence. Then the poverty and arrogance to death. So this patient will finally fall to death. This is the treatment which they used to give those days. So on returning to his surgery, the doctors covered the sheets of paper with scruples, grains, and drams of medicine. So they'll put some medicines and cover it with paper. That is medicines like amber, cubella, Haller's elixir, senna, aloes, oil of cajeput, village water. So all these are those days whatever extracts they used to make, and four liverworts. So these liverworts are the plants. So these sort of leaves and these sort of water extracts and medicines were all crude medicines were used those days. Then came after that they will use mustard baths and tartar emetics. So they will give mustard paste and bath, and then tartar emetics which will make them vomit, and blood leeches will be swimming excitedly in the water. They will be putting the blood leeches on the forehead and cuppings in the neck. A vein opened in the foot, and the sinister, that is enema. That is, they will give enema with vinegar, salt, and mustard, or the Saponita. So they will. This is the enema they will give for the patient, and they will also use hot iron applied to the crotch, oatmeal possets, mistletoe powder for bleedings, and red drop for convulsions. So these are the crude medications they used to follow, and which is really a torture for any patient who's in their hands. So Samuel Hahnemann was a compassionate person, and always years ahead of his time. Recognized the value of the occupational therapy and attempted to humanize the treatment of the mentally ill during his stay in Gotha in 1792, when where he ran a lunatic asylum. So in Gotha, a place called Gotha, in 1792, he was running a lunatic asylum. The description itself encapsulates his contemporaries' insensitivity, brutal approach, and mental health to mental health. So mental health was not considered as disease. So they used to keep them torturing, but he used to keep them lunatic asylum, where he treated in this lunatic asylum. Unfortunately, there was a patient called Herr Klockenbring. So this why we call it unfortunate is because he tried some surgery on this patient also, and he died unfortunately. So that is why it's called unfortunate Klockenbring. Hanneman wrote, "I never allow any insane person to be punished by blows or other painful body chastisements, because there can be no punishment where there is no responsibility. So and because these patients deserve only pity." So he said, why to punish the mentally ill? They are not responsible for the mental illness, and we should only be feel pity on them. The physicians in charge of these unhappy people must have the attitude which inspires respect, but also creates confidence. So he says the doctors who are treating the insane people, so mentally ill people should inspire inspire respect and also create confidence within the patient. In spite of the ravings and violence of his patients, Hanneman patiently built a rapport based on empathy, mutual respect, and confidence. So with the mentally ill, based on his behavior and interactions with the patients, he was able to establish a rapport with the patients. Even 50 years later, a leading physician commented on what a sort of time has elapsed since the insane were shown to the Sunday visitors. So when a patient comes who is mentally ill, they will be exposed to the visitors of the hospital and workhouses, and they will be teased by poking them with sticks to incite lunatic behavior in order to amuse the visitors. So when a person becomes insane and they were given to the hospital for treatment, the practice was to expose them to the visitors, and visitors used to irritate the patients, the lunatic patients, that is the mentally ill patients, poking them with sticks, and to when they throw tantrums, they will all be enjoying their type of behavior. So this is such a barbaric and inhuman type of treatment which was met to these sort of mentally ill people. So Dr. Rale wrote, "We lock up these unhappy beings like criminals in the cells, in desolate caves or damp cellars. We leave them to decay in their own filth." So this was one of the reports written by Dr. Rale, who said that they will be doing this sort of treatment only for insane people. It is because there is no treatment for that. Clearly matters might have been worse for King George, but even his rank was little protection against the cruel onslaught of his physicians, who enjoyed the power power over him, because the king in front of the doctor is a patient, and he has no power. So the doctors were enjoying that supremacy over the insane king, or the king which they made insane, and was treating him equally and torturing him equally as a common man. The unfortunate king's behavior was always bizarre, but with the onset of bouts of delirium, which we know today is a key symptom of metabolic disorder, porphyria. So this disorder is called porphyria. He became positively deranged. Because of this metabolic disorder, he became positively deranged. The physicians were ignorant of his conditions. It was 25 years later that the compassionate light of homeopathy arrived in England in 1835. It was too late for the king to benefit. So when homeopathy came to England, it was too late for the king to get this treatment. Two lines of the successful play. There was a stage play in which there is two lines written by Alan Bennett, the madness of King George III encapsulated the king's dilemma and the doctor's-patient relationship that prevailed at the time. There's a dialogue where the king says, "I am the king of England." Then the doctor objects, "No, sir, you are my patient." So this is the way they were treating the king also. That is, it was a famous dialogue in the play. Also, it was remembered by those people at those days. So this porphyria describes a group of conditions, largely miasmatic, caused by the accumulation of porphyrins in the body. So porphyrins are complex chemical substances formed during the synthesis of hemoglobin. 6 types of porphyria have been identified: acute, intermittent, variegate porphyria, cutaneous, tarda, hereditary and congenital erythropoietic porphyrias. Symptoms include limbs, cramps, muscle weakness, rash, or skin blisters in sunlight. So sunlight exposure, they will have problems. Abdominal pain, red blood urine, and psychiatric disturbances, memory loss, mental confusions, fever and salivation. So these are the overall symptoms of the disease which the king also had gone through. That is limb cramps, muscle cramps and weakness, rashes on the skin and blisters when the exposure to sun. Abdominal pain will be there. Red blood in urine, psychiatric disturbances, memory loss and mental confusion, and fever and salivation also will be there. So these are the symptoms for which they treat as a lunatic patient. Of the 6 identified types of porphyria, each of which has different symptoms, King George was most likely to have suffered from acute intermittent porphyria, hereditary coproporphyria, which are both miasmatic and in character. Both are miasmatic in character. These forms produce similar symptoms as mentioned above. King was certainly not mad, but unfortunate victim of either of these rare hereditary disorders characterized by the bout of lunatic behavior. So the disease had little mental symptoms also, which he was behaving like a lunatic patient, and so he was being treated as a madman and had to go through all the torture. He would certainly have benefited from carrying compassionate homeopathic treatment had it been available at the time. So it was unfortunate for the King George III to have this disease, and homeopathy was not there at the time. So homeopathic remedies to consider in this treatment of porphyria might be bryonia, cantaris, cuprum met, stramonium, colocynth, belladonna, hyoscyamus, arg met, arsan, sulfur, heparsulf, sepia. Then blood red urine indicates red blood in urine indicates heparsulf. So there is some infection somewhere and blood is flowing into the urine. Heparsulf, bryonia, cantaris and strammonia initially was given in 6 potency, whilst fever could have been controlled by belladonna and muscle cramps of the limbs could have been controlled by cuprum metallicum. Clearly, the syphilis miasm indicates that a single dose of syphilinum 30 may have been efficacious repeated after 3 months. However, only comprehensive repatriation and all presenting symptoms could have confirmed a single classical remedy for the problem which the King George III went through. The conclusion is, naturally, the patient would benefit from the caring, compassionate approach of homeopathy. The homeopathic treatment in the treatment of mental illness initiated by Samuel Hahnemann. The 21st century is now awakening to the basic tenets of homeopathic understanding and simultaneously addressing each human being in mind, bodies and spirit, the foundation of truly psychosomatic medicine. It is ironic that nowadays many conventional drugs, including oral contraceptives and some antibiotics, are known to induce attacks of porphyria. So now the medicines are inducing this. So now these are the references which has been quoted by the doctor. So I have also copied and pasted it here, and that's all for the time being. So just to say and conclude that homeopathy is much compassionate and the treatment with homeopathy will definitely help anybody. Even psychosomatic disorders are also treatable by homeopathy. So thank you all. Surendra sir, you can carry on, Surendra sir.
Surendra sir, your voice is not.
We can't get here through. I think your mic is bad, I think. You try
Voice,
to fix your
voice.
mic.
Voice.
We can't hear you. Your mic is bad. Maybe your mic is bad.
വിനപറ്റില്ല. Yes.
Yeah, we can hear you now. Yes,
Okay.
we can hear you. Yeah.
Okay.
There's some obstruction.
I know. Yeah, when I called, I think it was.
Okay. Good afternoon, everybody. Sorry for the teething trouble.
No problem.
See, many angles, though we know the concept of the cure with the medicines, is technical approach that has got lot of focuses. That is cues, angles, understanding, then deciding. All these things are important. One aspect is verbal and non-verbal cues in homeopathic case study. There are about 5 to 6 verbal cases. What is verbal? He expresses in words. Describes joint pains as stiff, aching, with sensation of being rusty. Though restox is indicated, but the joint pains feel stiff in action, works on the initial motion, but improves with continued movement. So, the expression is, patient says stiff, aching, and rusty. Rusty means it's giving you cracking sound. Then, second thing, verbal cue is description of symptoms. First is patient's language. Second is a description of symptoms. Patient reports that their headache is throbbing, works from noises, works from light, and accompanied by nausea. These are description of symptoms. Potential remedy is belladonna. Throbbing headache, aggravated by noise or light, and often accompanied by nausea. So, either patient language, description of the symptoms, give us the cue to the medicines. Third is expression of the emotions. Patient describes feeling overwhelmed with sadness and grief since the loss of loved ones. He expresses his loss in so many words. Of course, I have been telling you, potential remedies, Ignatia is indicated in the acute grief, sorrow, or emotional turmoil with symptoms of changeable and alternating symptoms. Then, fourth type of verbal cues are modality. Patient states the stomach pain is relieved by warm application of water or warm application, worsened by cool drinks. If he takes cool drinks, it becomes worse, stomach ache. But if he takes warm drinks or if he put warm appliances, then he feels better. This is called modality. Arsenicum was the best remedy. Stomach pain relieved by warmth, aggravated by cold, along with anxiety and restlessness. The fifth one is verbal cues. Concomitant symptom. Patient mentions experience headache with blurry vision and a sensation of dizziness. Blurry vision and dizziness. Sensation of, not actual dizziness. Sensation of dizziness. Potential remedy is Gelsemium. Gelsemium is indicated for a headache accompanied by blurry vision, dizziness or weakness, often associated with anticipation of nervousness. So these are all the 5 verbal cues: patient's language, description of symptom, expression of the emotions, modality, and concomitant symptom. There are other things like non-verbal cues, facial expression, body language, voice, tone and speed, physical gestures and postures. I will explain them. Facial expression. Patient grim face becomes very grim. Winces while describing their abdomen. That is, he make his face wrinkle while describing of this abdominal pain or articulation. Colocynth is the remedy indicated by abdominal pain with severe cramping or causing patient to double over the pain. Again, it double over. Then comes body language. Patient fidgets, paces around the room, unable to sit still during the consultation. Even when in the consultation, he will not be able to sit. He wants to get up, get down, wanted to move, so as if he feels discomfiture. He tries to lobby in the room, etc. etc. Aconitum nephilism is the, that is aconite, is the medicine, because anything suddenness and restlessness, anxiety, agitation often associated with sudden onset of symptoms. This is second one. That is non-verbal. All action oriented. 3. Voice, tone and speed. Speaks rapidly. No sir, I cannot, it's very difficult for me to say. It is always causing me trouble. I am not able to understand. He doesn't stop. Speeding, rapidly, loudly, expressing frustration and irritability. See, you don't know about my problems. I cannot explain also. I don't know how to explain you, etc. So, Naxomica is the medicine indicated irritability, impatient, intolerance to noise or contradiction, often aggravated by stress or overload. Often aggravated by stress or overload. Then, physical gestures. Patient gestures to their abdomen while he describes the symptoms of bloating syndrome. You don't know, sir. It's very hard. Right. He touches his abdomen now and then, or touches his headache. I can't say what is the gravity of the headache. Dizziness. I can't say. It's splitting headache. Very difficult. Very difficult. So, physical gesture. So, potential remedies, carbo-vegetarian. That is when he says, stomach is bloated, he could not sit comfortably, he feels somewhat discomfiture, so he will be roaming in the room, not knowing what to do, what not to do. So abdominal bloated gas, distension with sensation of heaviness and sluggish digestion. So carbo-vegetarian. Posture. Patient sits hunched over their arms, crossed, appearing closed off and defensive, always. Closed off. Closed off means he always closes, I don't know what it is. Defensive, I don't know what to do. I don't know where to go. I am very much in a very apprehension condition. Potential remedies, Staphylococcus aureus indicated suppressed emotions, resentment and feeling of victimization. He has been victimized by somebody. All posters only, not real. Feeling victimization, often manifesting as a closed off. I am closed off. And always will be in a guarded way. We don't, no, I can't go now. I want to be safe and comfortable. I can't trouble anybody. I want to be away, etc. These examples illustrate how verbal and non-verbal cues provide characteristics indicated by the patient which can guide the selection of the homeopathic remedy based on the totality of the patient's symptoms and equation. See, last class we have studied about the methods as to what has to be understood by the physician when the patient narrates everything. Today, we are seeing their expression, verbal and non-verbal expression. This is how the homeopathic remedy can be easily identified by the physician when the patient himself is in a position to lead to his remedy. He will lead you to his remedy, etc. Then another important thing is we call as a rubric. What is rubric? It has not been totally described, but it has been coined as a rubric by the brewers, while jotting down every symptom exhibited by the healthy patient. They have been telling about, supposing carbo, which if you take bloated stomach, uneasiness. So all these things are written by the brewers. All these things will be jotted down. There they coin some expressions. It is called rubric. It is nowhere you can find. I have seen the dictionary also. They have not explained about the rubric. You also go and verify yourself whether anybody has explained about the rubric. Alright, let us not worry about it. I will give you one striking example. Patient says, tell me what should I do? That means he wants to do something but does not know what to do. What should I do? He wants to do something but he doesn't know. He is not clear as to what he should do. And that is why he is asking us, what should I do? And the medicine common for these rubrics are chamomilla. We coin these symptoms as a rubric. What should I do? Rubric. Chamomilla is the medicine. The patient feels incapable of work, always feels unable to attend his business, or a sort of general reduction in efficiency. Then always feels like condemning himself for not being in a position to perform his duty. First, he feels that he is incapable of doing work. Then he condemns himself that he is not able to do his work properly. That is why he is being accused by his boss, or he is not able to deliver his potentials, given task, given work. He is discouraged and low-spirited, sometimes haughty, and other times he feels very, very dizzy. All these symptoms, we can put this into three rubrics. Business incapacity for contemptuous, that is, he feels that he is not able to, he is incapable of. Discouraged, he is discouraging himself. There is nothing like that, but he is discouraging himself. His mental symptom is like that. The remedy that covers all these rubrics of business incapacity, contemptuous of self, discouraged, alternating with haughtiness, hardness, taskers. So, we are not selecting the medicine by the patient's expressions alone. We go through the rubrics, that is repertorization. Now you see, repertorization is very easy. I have been time and again I am telling you. Repertorization is very, very easy. You put it to the computer, feed everything, you will get 2 or 3 medicines. So you tally it, then go to the book, boring. Read it, take the medicine, read it. See the other medicines that are indicated are the medicines that follow well. Then your clue is simple. So then how can we say that we are homeopathic doctors? Mission is giving, yes, even for allopathy, everything is done based on biodata, clinical tests. Understand? Not that we have to apply our mind, not that we should not simply ignore our probing nature. We must see that everything tallies, everything tallies. The patient's problems, your selection, then you are going into the rubrics, case taking, and everything has to be made as totality. And never forget to refer to, after coming to the medicines, go to the concerned medicine, see the medicines, whether the chosen medicine is correct, it tallies, it doesn't give any problems, and also see whether the concomitant medicines that also appear in all the selections through the computer is there in the materia medica, body. Then clarify yourself. This is how you have to establish your medicine taking based on the case taking. All right. I think you all have no more confusions hereafter. You can yourself boldly prescribe any medicine that's required by the patient. Then comes one more rubric is sweat. Sweat. The more he sweats, the greater the pain. Chamomilla. Easily profuse sweat without relief, with pains, oily face, foul smell, that is sweat is foul, sore, stains, indelible yellow on the head, on the chest, at night, mercurius solubilis. Sweat attracting flies. You got a sweat, but you see, I used to tell my wife particularly, when we both sit together in the nights during the winter, mosquitoes come to her and not to me. I told her, you are inviting. See, this is the thing here. Sweat attracting flies, caladium. Washing ameliorates sweat. You wash, ameliorates. You feel comfortable. Tuja is there. Urinous like, if you feel sweat is copious, that is you sweat. If you see your towel, it is just like wet cloth. Urinous like Cantharis nitric acid, because smell, nitric acid comes in. Company aggravates sweat. If you are in the midst of 5 or 10 people, you feel sweat causing aggravation. Tuja is the remedy. Lying on the right side aggravates lachesis. Sweat covers heat, ameliorates. Naxomica, Rustox, Staphanthus, etc. Sweat causes pain and aggravates. Chamomilla, Bergson, Rustox. Heart symptoms with sweat, spongia. Sweat, some parts of the body are bad. They are not having any sweat. Only some parts are bad. Tuja. Unilateral sweat. Beretta, Chiminamsa, Naxomica, Phosphorus, Pulsatilla, sulfur. So all these are rubrics. But you cannot choose everything. You have to come closer to the patient with these medicines, which are called rubrics. Honey-like sweat, tuja. See, 2 to 3 sweat rubrics are indicated in tuja. So you have to be careful there also. Awakes only due to or while sweating, sambucus. Steaming, that is, you don't sweat, it comes like vapor like phosphorus. Sweat profuse uncovered parts except the head, tuja, I have already said this. So, These are the things that rubric means. You need not think that, oh, what is this rubric? Why should I be concerned about it? Why should I be complicated? It's nothing. Nothing. We coin them with the rubric, the expression called rubric. And refusal to take medicine. Arnica, Simitsibiga, Hyoscyamus, Caliphas, Lachesis, Tremonium, Paratremvirate, Viscum album. Refuse, decline to accept. Why the patient has to refuse medicine? Why he refuses the medicine? It is not, some will say, it is not pleasant to take medicine because lot of side effects. If I go to homeopathic first consultant, it causes aggravations, and there are lot of questions. I am allergic to the questions, like that. But one has to get rid of the problem. You don't want to take medicine, but you want to get rid of the problem. A patient who is in pain or suffering from any kind of sickness, when refuses to take the medicine, there has to be some reason behind it. So, physician immediately feels there will be some reason. That is, depressed. Depression is the reason. That is, he don't want to spend medicine on medicine. Problems will get there. What is there? If I wait for some time, it will go but automatically. Past bad experience. I have tried everybody. No medicine has cured me. No refractory result of the medicine already taken. I have taken medicine, but it is not help. Then what should I do? Why should I go for medicine? It is like consuming a poison. Oh, medicine. Just take poison, it's causing a lot of problems to the body. And it gives a lot of side effects. No need to spoil body with chemicals. See, you put chemicals only in the body by way of medicine. So it will go and spoil the body. Why should I take? And I don't have scope for recovery. I don't have scope for recovery. No hope for recovery. Discouraged in life. Rubric. No desire to live anymore. Oh, it's better to die. I don't want to end myself. I want the end to come in its own way, quickly. I am financially weak. That is also a rubric, causing a lot of mental torture, causing you illness. Likes to be treated by non-medicine substances. Sir, natural cure is there, I'll take that. I don't want to take medicines. No, you take this, you take that. Herbal medicine. Family tradition. Oh, my family traditions. We don't take medicine. You won't believe. There's a Christian family in Tamil Nadu where none of the family members take any sort of medicine. They go for prayer. Family tradition. They have no respect for the medicine. As it is useless, it does not help. Patient says, I don't have respect, sir. Why do you trouble me? Got bored of taking medicine. So all right, some expression again stated. Do not like the taste of medicine. Sir, our homeopathy is a sweet pill. No, sir, even the Ragna Sarpatina. several Saralika, Berpenzol, they are not sweet. Tinctures are very sour. They will say, do not like the taste of medicine. It is better to be without medicine. So, these are some of the expressions that is expressed by the patient who refuses to take this. See how many things we have to go through as a physician. More than the patient, you are bloated with so many problems in your stomach when the patient comes to you. Okay. I wish this would have given you a clear magnitude of picture, clarity of the problems. You can easily prescribe. No problem at all. Let what may come. Give medicine. Nothing will happen. Give low potency. Then he feels somewhat better, go for higher potency. If everything is good, because what you chosen is correct. You must have the capacity. Oh, so many problems. If the medicine will work, if the doctor thinks like that, he cannot choose the medicine at all. You fail to choose the medicine. So be bold. Be bold. 30 to 40 medicines, you keep it in the chest. Give. You also put it into your stomach, mouth, and see, observe. Nothing will happen. Because all the 30 drugs are very safest drugs that are being given in the chest. Nothing will happen. Even if something happens, it will be there for a little time because it's only 30. Or you feel discomfort, you smell camphor or take cough. That's all. I told you, I had a very bitter experience. Karma vegetables, one of them taken, accident. My head was reeling from standing posture. I sat down. I asked my wife to give some decoction because she doesn't know about Naxolvicar and other things, or it will take some time. I have taken decoction, just one gulp. The very next moment I am out, completely out. The other thing is, carbon with low potency, if you take it, will become normal. But as such, for that, it just take some time. So, nothing to fear. Okay, thank you, all of you. Start practicing and be bold homeopaths. Thank you. Okay, handing over to one.
Thank you, sir. It was very good. Okay, sir.
Sir, thank you very much, Surendra Garu. Very nicely, not only good lecture, but you encourage everybody.
Correct.
So let them start from today onwards. And tell your friends also who are not coming regularly, who are regular absentees, please inform them also. You have to take some medication every week. Small in the house itself. Every week we will learn a lot. Any doubts? So small thing we will take. Palpitation. Generally, palpitation, it is not, I am not going deep into heart trouble. Generally, palpitation, how it will come? Above 55, 60, generally people will have palpitations. It is because awareness of the heartbeat, rapid, sometimes forceful, caused by sudden fear, excitement, anxiety, emotional imbalance. Sometimes during weightlifting, we will not go into deep into heart disease or neurosis. We will think about the palpation of different angles. Sometimes weak heart, overactivity of the circulation, tremors, sometimes flatulence. Our Surendra sir has told carbo is like that. Because of some stomach indigestion and any acidity like that, it will come. Hyperacidity, chronic bronchitis, asthma and emphysema. These are the things where we will get the palpitation, apart from heart trouble. Suppose if any person is having feeling only, the person will come, I am having weak heart. We cannot ask them how you know. Simply we will ask how you know means, see, whenever weak heart means at the age of 60 or 65, there will be so many problems. It is a retirement stage, some burdens will be there in the house, something unable to tell to so many people. At that time, if anything happened in the house against his wish, generally he will feel slight palpitation. That is also, he will think it is a weak heart. It is not a weak heart. There you ask, whenever it comes, you take Aconite one dose. That is sufficient. Aconite 1 dose. Otherwise, you give Arnica and Carbovig. Always persons who have completed 60 years, keep with them Arnica 30 pills, Arnica Carbovig 30 pills. You can take just 5 minutes gap, morning, afternoon, evening also. Within 2 days, you will be perfect. Arnica will make the circulation proper. Carbovig will throw away your carbon dioxide from the body, and by that way the oxygen will go freely into our body. So Arnica and Carbovig, always you ask them to keep. You give it to them. And Aconite, whenever they are feeling this emotional imbalance or whenever they are feeling fearfulness because of the small things happened in the house or outside, at that time you can give Aconite. And we will need not go into deep. Suppose if he tells weak heart, generally you give for his satisfaction, you can give what we call Terminalia Arjuna. Generally every person will call it as Arjuna mother tincture, Crataegus mother tincture and Passiflora mother tincture. If you want, you add cactus also. So previously I told CRP formula, Crataegus, Rauwolfia and Passiflora. That is, it will control the blood pressure, it will control the heartbeat, frequent heartbeat, and it will make your nervousness calm. So that is CRP formula. Here, if you feel, or if the concerned patient tells that I am having a weak heart, means you can give Crataegus 10 drops and Terminalia Arjuna 5 drops is sufficient. If you feel further anything, chest tightness is there or like that, you can give cactus, otherwise not necessary. These two things will happen. Whenever any emergency is there, Aconite you can give, or frequently it is coming means Arnica and Carbovig for 3 to 5 days. Otherwise, daily you have to give minimum 3 weeks to 4 weeks Crataegus and Arjuna. Sometimes children at the age of adolescent stage, suddenly they will grow very rapidly. So because of the rapidity of their growth, they will do all work very hyperactively. At that time also, they in that age itself they will get palpitation. They will run, they will go staircase, they will come up and they will talk to you. When he is talking, palpitation will be there. At that time you need not give any unnecessary things. Argentine nitricum, because of nervousness, that is sufficient for him. And China, because sufficient energy has not gone inside to the body because of the sudden growth. So at that time you can give alfalfa mother tincture or alfalfa tonic, China and Argentine nitricum. This is sufficient. Due to dyspepsia, for this, dyspepsia above the diaphragm or below the diaphragm, that is in stomach area or esophagus area. If it is esophagus area, previously I told it is esophagitis, or we will call popularly as GERD, GERD. For that you can give what I called Abies nigra, Argentine nitricum, Carbovig. These 3 medicines are sufficient. to 5 to 7 days because of the dyspepsia. From emotional causes are there means you can give anacardium if he is getting sudden outbursts and he is having two wills. Sometimes he will get angry and he will talk something nonsense, sometimes he will talk very loudly. At that time anacardium will work, and due to emotional imbalance you can go ignitia, and our Surendra sir just now half an hour back he told about Staphylos aureus. That is ignitia, natrum, Staphylos aureus for 3 days, morning, afternoon, evening. Like that if you give, that type of emotional palpitation will reduce. And nervous irritation will be there. Generally all we people will feel the nervous irritation. Suppose if you don't like my lecture also, you will get nervous irritation. At that time you can give Coffea cruda. Very good. Coffea cruda you can give. Hyoscyamus you can give. Lilium twig will work excellently. And ignitia also. Because some people are having hemorrhoids, piles, fissures. With that, always they will think of that only. They will be very nervous because of the disease. At that time, if they are having any palpitation, you can go Cordus Mariana, Collinsonia, Rathania. And because of anxiety, because of fright, this comes means main drug is aconite. After that, belladonna. These two drugs itself will make him perfect. Sometimes, even if they walk in the house itself, if they get palpitation, you can give Carboveg and Coca, COCA. Carboveg and Coca. Palpitation and dyspnea, both are similar, but the palpitation will not reduce immediately after taking rest. Dyspnea it will continue because there will be some bronchitis problem or asthmatic problem, or bronchial tubes may become thin. At that time you can give Cactus, Crataegus and Pulsatilla. Of course Carboveg also. Pulsatilla will reduce because we will eat more carbohydrates. Last class or a previous class our Anup Kumar has told, without having any pancreatic problem, the persons will have diabetic. For what are the causes, what are the symptoms, and what are the medicines available. Very excellent lecture he has given. That without any pancreatic problem, if a person is having a diabetic means, his lecture you listen. You simply read. I have already asked him to repeat the same thing because at that time what we called this recording is not there at that time. So if you take once more after 2 weeks or like that, it is very, very useful because we need not think diabetic means it is only pancreatic problem. So there are other problems. Because of that also diabetic will come. Palpitation, sometimes you can give Convallaria, Crataegus, Digitalis also. Sometimes sudden fluttering thing will be there in the heart. Feeling at the time Digitalis 1 or 2 doses of 30 potency, this will work excellently. And always remember Naxwamika whenever you are feeling other parts in the body is excellent. Something is coming because of stomach, or something because of emotions, or something because of irritability, or something because of what we call angry. All these things put together, Naxwamika daily 1 dose, minimum 1 week night. That will saturate so many things. Naxwamika itself is a very best remedy because nowadays very fast life. Everybody is very, very fast life. Why their life is fast? Their life become fast. Nobody knows, but they are fast. You ask anybody, sir, I don't have time. I don't have time. So those people, if you give Naxwamika night daily in 30 potency itself, that is sufficient. And another thing, Naxwamika, if you give 1 week or 10 days, motion problem will be also be reduced. Constipation, anything is it will reduce. That is not a chronic constipation. General constipation is there, means it will reduce. And palpitation because of sleeplessness. For this also you can give Ignitia, Caliphas, Opium and Passiflora. These are the medicines. Ignatia, Califas, opium, and passiflora. Passiflora mother tincture. 15 drops minimum you have to give. Twice you have to give. Then only it will. It is a slow acting remedy. Passiflora daily Califas 6x. You take morning and evening. After that you take passiflora 15 to 20 drops morning and evening. Within 15 to 20 days you will have good sleep. Good sleep means not a allopathic tablet madri work. It will not work, but it will work. Your mind will become calm and you will have natural sleep. And palpitation and vertigo. So many people are having vertigo. They will take always 16 mg minimum. Minimum 16 mg they have come. So because of this one, palpitation will be very frequently it will come. At that time you have to give conium, Coculus, coca, and you can give China and acid fast also. Because of over medication to control the vertigo, if you have any therapy in homeopathy also, if anything comes palpitation due to vertigo and due to over medication, you can give conium, Coculus and acid fast or China. These 4 drugs will work excellently within 7 to 10 days. Sometimes palpitation because of drainage of our vital forces, because of vomitings or because of diarrhea or because of summer you are going out and more sweating is there. At that time you can give China is one of the best remedy, and ferrum met and Viretrum album. These 3 medicines are very, very good and everything. And whenever you have gone in the hot sun, you must keep remember belladonna, glonine, natroncarb. These 3 drugs will excellently work. Keep it in mind. In this all summer season, we have to keep these 3 drugs in our house. So all these palpitations, what I told, it is a simple subject, but everybody is facing this type of palpitation, and any person in the young age or middle age also, if they are here having a that is what we call the body is heavy, hectic body and more weight, at that time a small thing also, if anything they do means, if they get any palpitation type of breathlessness, at the time calcarea carb will work, provided there must be more weight. They should, lean people we should not give. So calcarea carb is also one of the remedy for this. And any ladies because of uterus problems, if they are having any palpitation, you can give pulsatilla in the beginning. If pulsatilla is not working, full satisfaction is not there means, then you have to go sepia. Sepia is one of the best remedy to control all those things. With this my lecture is over. If anybody palpitation because of anemia is also there. So for that, arsenic album, ferrum fast, ferrum met. These 3 medicines are because of anemia, palpitation is there, we can give. So with this my lecture is over. Any doubts are there, please ask.
The palpitation can cause arm pain also.
What's that?
Palpitation can cause arm pain in the hands.
Oh, no, I can't hear you properly. Tell me.
Arm pain in the hand.
He's asking, sir. He's asking whether because of palpitation will you get pain in the hand?
Yes, it will be there. At that time, the cause is heart. At that time, you are having Kalmia is one of the best remedy. Kalmia, Kalmia, Kalmia. For that specifically, if you are having left side problem, any pain or anything is there, we are having excellent remedies. Spigelia, Kalmia, Arnica, and Naza, NSAA. Naza and Lactodectus. That is also one of the best remedy. Please you read all these 5. One is Lactodectus, Naza, Spigelia, Arnica. One more thing I told. These 5 drugs, please read today itself.
Okay.
Because heart to oriented palpitation is there means you have to give Arnica, Lactodectus, Kalmia, what we call Spigelia, Naza. These 5 drugs, please read. Only one paragraph. You need not go to entire materia medica. In heart portion you can see this one, in respiratory portion you can see. Wherever you are having this one, note down that one. Immediately you will have. And all these medicines are safe. You need not worry about it. Any doubts? Hello?
Yes, any,
If no doubts are there, we'll close.
no, I just want to ask, what is the physiological expression of palpitation? How do people palpitate?
Sir, can we take Califos and Passiflora together?
Yes, yes, you can take. Passiflora and mother tincture, Califos
Yes,
in
sir.
potency.
Califos 6x and
6x.
Passiflora.
Yes, yes. Sometimes 30 also you can give, no problem, but 6x will work excellently.
You can take together.
Yes, yes, yes.
Thank you.
The question is, what is palpitation?
It causes of sleeplessness.
No,
What is,
how do you
he has
feel it?
asked
How
what
do you
is
express-
palpitation?
How do you feel it? How do you express it to another person?
I don't have palpitation only for sleeplessness.
No, I generally ask the question. Generally, what is palpitation?
How you will feel palpitation?
Yeah, how do
A
you
person
feel
is coming and is telling I'm having palpitation. How you are feeling? What question you will ask as a doctor?
The throbbing sensation in the heart. Some sensation will be there. Some sensation will feel.
in the sense how you feel the heartbeat is more?
Sometimes may feel.
Yeah. Okay, so
Maybe heartbeat increases
yeah,
beyond normal,
correct.
beyond 90, it
Yeah.
increases maybe palpitation.
No, technically, why do heart beat in a normal pace and why suddenly it beats in a faster pace? On a healthy person, I'm talking, not on a diseased person. Normally, a healthy person would have a pace of heart beating, no?
Certain emotional imbalance can create palpitation.
No, true. So
Sudden-
what is triggering it? This is not to question make a debate out of it, but I'm just telling you there is a normal pace. When you are normal, you feel heart beats in a normal manner. Suddenly it beats very fast. So on a normal person, it will not happen. On a normal healthy person, when he does something only, it will happen. If he exerts, if he does exercise, if he climbs the steps or stairs, or if he runs, or does something, it happens.
Fear also can create
Too much
If he exerts, the heart beats more. So next question is, if suddenly you scare him,
certain fear is there.
you
Fear.
scare him because of something, by bursting a cracker near him, or scaring him, somebody close to him has some serious illness or something, worrying him, then his heart beats again faster. So worries also can create heartbeat, increase heartbeat. The fear also can increase heartbeat.
Yes.
So what happens? Why is the heart beating faster? What happens when the heart beats?
Blood flow increases.
When blood flow increases. And what is the purpose of increasing blood flow?
To cope up with this.
Yeah. Where does the emotion affect? Where does the feelings affect? When muscle is activated, the heart beats increase. When brain is activated, the blood flow increases. So somewhere some fast activity is happening and the blood is being pumped faster. So blood flow is increased to increase the oxygenation in that area, particular area, either the muscle or the brain. So palpitation is without any cause, means there is something happening in the system, and for which we have to find out the cause by talking to the person. Either it is fear or something else, and then we have to diagnose. So a lot of medicines Dr. Murthy has told. So easy way to cure the patient is to have a talk with him and find out what is really triggering the palpitation, and then address the treatment. So I think this is just for thinking. I just put the question. So all of you think and then come back to us. We will help you out. Okay, sir?
Yes, sir. We'll close.
Okay, sir. So thank you all very much, and for it was a very good
Thank you,
session.
sir. Thank you very much. We will meet next week.
Thank you all. Thank you all.
Thank you. We'll meet next week. Thank you.
Thank you, sir.
Thank you.
Thank you.